Welcome to Columbus Downtown High School. I'm the principal, Cheryl Watson. I'd like to thank Dr. Dixon for selecting our school to hold a press conference. At this time, I'm going to introduce Columbus Board of Education President Jennifer Adair.
Thank you and good afternoon. Welcome to Downtown High School and welcome to this press conference where we are going to have some news about the upcoming school year. Salubona, Columbus community. That's a Zulu greeting, and it means we see each other, we acknowledge each other, and we recognize each other. As we listen today to the news that we're going to give, it's really important to think about how we remain a community during this time. Last time we were in this room, we were working on Portrait of a Graduate, where the community came together to help determine what it was our future graduates need. Concepts like adaptability, communication, creativity, global empathy, were all things this community, the grown-ups of Columbus, said all future graduates need. I ask as you listen to the news today that you remember these concepts, and not just for our students, but for ourselves. The decisions to get to this point took a lot of effort, and I want to personally thank from myself and on behalf of the board, who's behind me, as well as Board Member Brown, who is at home safe. So I want to recognize Board Member Beckerly, Board Member Dr. Pierce, Vice President Reyes, and Board Member Ragland, who is here, that it took the effort of a lot of people. And in order to do this, we had to remain flexible. We had to listen to the advice of our health director. We had to listen to our parents and our teachers. We had to listen to what our community needs as a whole. And when I speak of community, all of us want our children to be educated. That is the number one goal, always the number one goal. We have 50,000 students in our district, 10,000 staff members, 100,000 families and friends, community members. Our district impacts every piece of what this city is. All of you, the entire community, went into making this decision. We had collaborative input, and I'm proud of our team. I'm proud because in this time of great uncertainty, they worked diligently, being flexible and adaptable, and you know that's hard for government to do. But they did it, and they will have to continue to do it. So what's next? We will come up with a better plan. A better plan. We will continue to move forward in a better way. It will never be perfect. There is no such thing as perfect. Will it be better than March? Yes. Will it be better than summer school? Yes. Will it be the best we can have it? No. Because every day is a process to move forward step by step to get to the broad vision of creating a 21st century model of education for this city, something every student and every community member deserves. So welcome to this path, Columbus community. Welcome to the next steps in engaging our district in full-scale technology and education, something you told us you wanted as part of a Portrait of a Graduate. This will take more community engagement. It will take innovative ideas. It will take business community and neighbors and parents and our city partners all to step up to really embrace what this concept of a village has to be in the middle of a pandemic. It takes all of us. We will come up with innovative solutions. We will come up with ideas to best serve our kids, and we have some of those now. We have never moved as fast as we have since March. We have made great strides, and we have even more to make with your help. Now, you are going to hear the news today, and many of you may be upset. You may be mad. It's going to be a personal inconvenience to you. I'm a parent. It is a personal inconvenience to me, but it is for the betterment of our entire community. We have to, as the grown-ups of this community, maintain a positive attitude for our students. We filter into them and pour into them the emotions that we feel. You guys, it's the start of school. This is exciting. Let's be excited. Let's be excited for that new kindergartner who's starting their journey. Let's be excited for that student going into middle school, high school, on their path to graduation. This is an exciting time. Please remain excited. Please remain excited for our students. They need you to succeed. We will hear the news today, and I will tell you, not all of your questions will be answered. Not every decision has been made, but we promise to communicate with the community, with our staff, with our families, and let you know where we are in the moment that we are in it. We welcome your ideas. We welcome your solutions, and we welcome you to this new journey that we are all on. So we're going to have Dr. Dixon come and share the news with us, and we will remain excited. We will step off on a positive note, and we will do this for all of the children of Columbus. Sau Bona, Columbus community. We see each other, we acknowledge each other, we recognize each other, and we will move together to make great strides for our school district. So I will turn it over to Dr. Dixon.
Thank you, President Adair. And I, too, would like to thank you and the Board of Education members here with us this afternoon, Vice President Ramona Reyes, Board members Kara Beckerly, Michael Cole, Dr. Tina Pierce, and James Ragland. Thank you for not only being here this afternoon, but also thank you for all of your leadership, advice, counsel, which has been invaluable as we work through this year like no other. Also, thank you, Mayor Ginther and President Hardin, for your continued partnership. Most recently, your support and sharing of the city's CARES Act dollars to help put technology in each of our students' hands. And thank you to Dr. Roberts for joining us today. The guidance provided by you and your team and your willingness to listen to our concerns and answer all of our questions has been remarkable. You are a true asset for our district and our city. As all of you know, on Friday, July 17th, I sent a letter to all district employees with an update about our reopening plans. I also sent a similar letter to district families. The update I shared in those letters was that the district needed to pause its initial opening plans, which called for students in grade pre-K through 8 to start the school year with a blended learning model, and for high school students to start all remote. Earlier that week, I had asked Dr. Roberts and her team to provide my cabinet and the reopening task force leaders with an update on the status of COVID-19 infections within our district boundaries and family zip codes. The numbers were sobering. Safety must be everyone's top priority. providing a safe learning environment for our students and staff is always a tremendous responsibility. During this very serious COVID-19 pandemic, that responsibility has life and death ramifications. Fast forward just 11 days to today. The public health conditions have worsened. The spread of new COVID-19 infections continues to increase dramatically in the city of Columbus and within our school district boundaries and zip codes. Although it was our hope that we could return to some form of in-person learning in September, the risk of bringing back 50,000 students and 10,000 employees to our buildings in the fall is far too great. Even with the use of all the social distancing protocols that we all know about, we cannot take the risk. Therefore, Columbus City Schools will begin the 2020-2021 school year fully remote, meaning all virtual learning, for grades pre-K through 12. We will operate in a completely virtual learning environment through at least the first quarter, which is Tuesday, September 8th through Tuesday, October 27th. It is important to understand that virtual learning this fall will be different than the online classes that began in March and April when the school buildings were closed by Governor DeWine's order. Prior to September 8th, our teachers and staff will participate in training for a new curriculum. Teachers will be in contact with their students on a frequent and regular basis. Parents will receive information next month from their school principal. In the interim, we're providing answers to the most frequently asked questions. I know families will have lots of questions about what this means for their children. I know all employees will have questions too. We are working around the clock to finalize details and logistics and to call upon our community partners to assist. As the largest public school district in Ohio, we have a lot of work to do and details to complete. We'll also provide information next month regarding how to access additional services for educational support, social and emotional support, breakfast and lunch grab-and-go sites, technology, and other basic needs for our families. The district will continue to engage with families and staff and seek feedback through the first quarter of the year to make any necessary adjustment to learning environments. I understand that this news of starting back in the fall with a fully virtual learning model will please many parents and families and many employees. I also know that there are many throughout the CCS community that would not be pleased with this decision. However, ultimately, safety and health concerns led to a final decision that would keep all of us safe as we work collectively to lower the rate of COVID-19 infections. With the mission to protect the health and safety of students, families, staff, and the community at the forefront of our decisions, CCS will continue to monitor public health conditions within its boundaries before determining when it is safe and practical to begin in-person learning experience. Thank you. And now I would like to welcome Mayor Andrew Ginther to the podium to say a few words.
Thank you, Dr. Dixon, School Board President Jen Adair, and all of the Board of Education, to Dr. Roberts, to Council President Harden, and members of City Council. I want to thank them for all of their work and partnership. When I was in the 4th grade as a student in Columbus City Schools, I had the awesome blessing of having the greatest teacher I ever had in my life. Her name was Ruth Hale. She taught the 4th grade at Brentnell Elementary School. She was married to a powerhouse academic, Dr. Frank Hale of Nebraska, Kenyon, and Ohio State, but Mrs. Ruth Hale could hold her own in any classroom around the world. It's my favorite year in school, and she was my favorite teacher. We had to study all 9 body systems and do book reports every week, not chapter books, or not picture books, chapter books, she would say, chapter books. And I was struggling one week to find the right chapter book, and she introduced me to a biography on Robert Kennedy. I had heard of John Kennedy, his older brother, but didn't know anything about Robert Kennedy. And it helped to launch me into a career in public service that Mrs. Hale fostered and nurtured during the course of our time together. One quote from Robert Kennedy that comes to mind a lot lately goes like this: "All of us might wish at times that we lived in a more tranquil world, but we don't. And if our times are difficult and perplexing, so are they challenging and filled with opportunity." Leaders are often faced with tough decisions. I cannot think of a year when we've been faced with more of them. I know that this decision to postpone in-person classes for Columbus City Schools is a difficult one for Dr. Dixon and the school board. And I know it will be difficult for teachers and families too. But I applaud Dr. Dixon for working closely with Dr. Roberts and basing her decision on the data and the science that is available to us today. Last week, the City of Columbus announced that we are providing $7 million of our CARES Act funding for Columbus City Schools so they can provide a Chromebook and internet for every student in the district. We believe that will be a game changer in how we manage this transition and a foundation for the future of virtual learning, an incredible opportunity to attack inequities and disparities that exist. I know that Dr. Dixon and the school board are also taking extra time for additional training for teachers in how to engage students virtually, and probably some help for some parents too. I've had to engage in a little virtual education of my little one here in the last year or so, and I have a lot to learn from educators. This is the definition of leadership: turning a trial into an opportunity, and in this case, to engage and teach differently. The situation we are now in is not permanent, but actions we take today will help us emerge on the other side stronger and safer. In the meantime, we must focus our attention on assuring that our young people remain healthy, engaged, challenged with academic rigor by their professionally trained educators, albeit being delivered differently than we had hoped for the time being. It's now my pleasure to introduce our leader and a great public health advocate for this community, Dr. Mushika Roberts.
Well, good afternoon, everyone, and thank you, Mayor Ginther, thank you, Dr. Dixon, and Board President Adair for having me here today, and for your thoughtful partnership as we all work together during this COVID-19 pandemic. I know these are very trying times, and Columbus Public Health is proud to work with you, along with you, to protect all Columbus City School students, teachers, staff, as well as their families. Really, we're helping our entire community. As the mayor and so many others have said, these are not easy days. These are not easy decisions that we all have to make, but we're making them to make sure that we meet the educational needs of our students while also protecting their health and the health of those around them. But the facts drive our decisions, and we must use those facts to help us make the right decisions for the health and safety of our community. Cases here in Columbus continue to rise. We currently have over 12,000 cases, and unfortunately, we've lost 389 of our residents due to this virus. Let me paint a picture for you of just how things have changed just in the last 6 weeks. If we look at the data in mid-May, the 7-day moving average for cases was 106 cases per day. By May 15th, the 7-day moving average had decreased to 86 cases per day. And then it continued to decrease until we got to mid-June. By mid-June to mid-July, we saw a substantial increase, and the 7-day moving average jumped to 217 cases per day. That's an increase of 220%. It clearly shows that this virus is circulating and there continues to be wide community spread. As you know, Columbus was recently named as 11 cities to watch by the White House Coronavirus Task Force, and they encouraged us to take aggressive steps to combat the spread of COVID-19. Franklin County continues to be at level 3 or red county during the state's public health advisory system, so that's something we're also monitoring. Given all of that I shared with you, now is simply not the time to risk the health and safety of our students, our teachers, and our staff in bringing them back to classroom face-to-face. Until we can reverse these trends, children and their families and our entire school community are at risk, and we must do everything we can to protect them and prevent the spread of COVID-19. The steps announced today by Dr. Dixon and Columbus City Schools will help us reduce those increasing numbers during this pandemic. We will continue to monitor our cases as we always do. We'll continue to work with the mayor, Dr. Dixon, and all others in our community to protect the health and safety of Columbus City Schools and all of our residents during this pandemic. I thank you for your time this afternoon.
Thank you, Dr. Roberts. Thank you for your guidance during this incredibly difficult time. To our mayor, thank you for your partnership and your leadership. To our superintendent, what a couple of New Years this have been for you. But we really appreciate your leadership in making these decisions. And to President Adair and the Board of Education, thank you for being in the trenches with and for our families as these conversations have progressed. As a proud Columbus City Schools graduate, I'm glad to be with you this afternoon. It's important that we stand together during these unprecedented times. We've heard from parents and teachers over the past few weeks about the concerns about schools opening during the COVID-19 surge. We stand here together today to let you know that we hear you. This is an incredibly difficult situation facing our community, and we have to do the basic things as individuals and as organizations to limit the spread of this virus. As individuals, we know what we have to do, and we get these directions from Dr. Roberts. We have to minimize the amount of people that we are around. We can't invite all of our friends and family over to our backyard cookouts. We must wear a mask when we go out, and we must continue to wash our hands. But in order to make sure individuals can do the right thing, organizations need to lead. That's why the city put forward a mask mandate prior to governor's eventual order. That's why last night we passed legislation to close bars, restaurants, nightclubs at 10 p.m. And that's why council voted unanimously with the leadership of my colleague, Chair Elizabeth Brown, to approve laptops for 20,000 students bought with dollars, federal dollars, from our leaders like Joyce Beatty, Sherrod Brown, and our congressional delegation. The decision to go virtual is not an easy one, as everyone has stated. However, it is necessary. It's necessary if we want to keep our children safe, if we want to keep our families safe, if we want to keep our teachers, our bus drivers, and so many more protected. Going completely virtual to start this school year will save lives and prevent the spread of this deadly disease. But this is a huge challenge for our schools, and that's why we all must stand together. Council is committed to our youth, and we will have to continue to work with Dr. Dixon, her team, the school board, to wrap services around our young people to address the many needs that we know will come because of this decision. Our kids won't be able to make the strides they need to unless the entire community, that's families, that's church, that's government, nonprofit, the business community, unless the entire community comes together and finds the big ways and the small ways that they can help out to ensure that our kids have a safe start to the school year. Thank you.
Y'all, school starting. Isn't that exciting? It is exciting. But just as everyone said, we have to be in this together. If you, as a community, want our students to be able to walk into a building sooner rather than later, we need you to take the advice of Dr. Roberts. We need you to mask up. We need you to wash your hands. We need you to limit exposure to others, because we all want our kids to come back. So that concludes. We will now take questions. There's a microphone here if anyone would like to come and ask questions.
Ted Hart from NBC4. I have a two-part if I could. As the mayor said, these are not permanent conditions, but I guess to Dr. Dixon I would ask, so the way this gets handled, though, could have permanent consequences on some of these students, and the way they, some perhaps may not be well suited for all virtual learning. And so you mentioned teacher training. I guess I'm interested, what are you going to do to make sure that kids are not permanently affected in a negative way as a result of these consequences? And to Dr. Roberts, I would ask, so what conditions would you be looking for to see in terms of data and science, at which point you would be able to say to Dr. Dixon, okay, I think we're okay to reopen the schools?
We'll have Dr. Dixon and then Dr. Roberts come up.
Thank you. Well, the minute we understand that all students learn at different levels, we will provide whatever support our students need to learn in a virtual environment, such as we will have more touch points. We will have teachers reaching out to our students more often. We will use some of our additional support staff to help students. If it's time for tutoring, if they need to meet with their psychologist, whatever the supports we do, we're going to customize it. You know, when we think about the word equity, how do we provide equity? It's making sure that each kid has what he or she needs. And that's what we're committed to do. And as everyone has stated also, is additional support. Who are those partners that we can reach out to provide the additional supports for those students who have a greater need? So we will continue to monitor that. We have 10 days. We moved our school district, our calendar back to September 8th purposefully because we wanted to make sure that all of our staff had an opportunity for some additional training. And that is, we have new curriculum we're rolling out this fall. We wanted to make sure our teachers were very aware of that curriculum and they had the support to implement that curriculum with fidelity. And also getting our other staff members to help lift our online learning platform. So it's everyone's job in the organization to help in that. And that's what we're committed to do with those 10 days of training. So we have a lot of work to do, a lot of learning to do, and we're taking a lot of best practices from our teachers and what they learned in the spring. So we had a lot of teachers who had a lot of creative and innovative ideas that we can implement in the fall, and we're going to do that.
Well, thank you for the question, Ted. I've been very clear in my communications with all the schools that we took our kids out of the classroom in March when we had just a handful of cases. And to bring them back into the classroom at this point when we're seeing this volume of cases is not the best thing for the health and safety of not only of our students, but also the teachers and staff. The guidance that I've given to schools is that we need to wait until our community has seen a consecutive 4-week downward trend in cases. And then we can discuss what it would be like to go back to the classroom. But until we reach that, I have made a recommendation that they not bring kids back into the classroom. So 4 consecutive weeks of a downward trend in cases. Now, that being said, so many of our cases right now are young and asymptomatic. If that were to change, and we would see a similar volume of cases we have now, but see a demand on our hospitals because we start to see older patients or older cases or more complicated cases, that would be a trigger too to say maybe it's not the time to bring our kids back to school. But if we continue to see our hospitals have capacity and we see this 4-week downward trend, then I think it would be much safer than it is today to bring our kids back to school.
Other questions?
Hi there, Lisa Rontla with ABC6. Want to ask, you are the biggest school district in Ohio. There's been a lot of rhetoric coming out of the White House. Some call it threats, saying if you don't open up, then you're not going to get federal funds or an incentive for school funds. Have you reached out to Senator Brown, Senator Portman, as the HEROES Act is still being considered, and how many stimulus dollars public schools will get in that package? Also, on a more state level, at the State House last semester, we did see a lot of waivers when it came to standardized testing because it went fully remote. Even graduation requirements, some were waived. Are you going to advocate for more waivers this semester?
Certainly, issues of funding and advocacy on funding at both the state and federal level are ongoing. No matter if it's a pandemic or not, public school funding is critical and we need more of it. We work all the time with our partners in trying to collaborate and to push our message and to advocate. So those are critical pieces that that we continue to work on. Dr. Dixon, did you want to? Okay.
Anything about the state level on
Oh, I'm sorry, the standardized testing. We will continue to look at that. One thing that we are committed to, and I believe the mayor and Dr. Dixon both referenced it, we are very much interested, and it is our job to educate our students, which means that we have to ensure rigor, even in a virtual setting. And so we will look at what we think is fair and advocate for that. But it is critical that we teach, that we evaluate, and that we measure the progress of our students. And so those will be continued things that we'll look at and discuss as a district. Did you want to jump in here, Dr. Dixon? No. Okay. Additional questions?
Hi, Sierra Lucas with ABC6. What does this announcement mean for fall sports?
Dixon.
Thank you. A great question. We are going to continue to follow the guidance of our health officials. And once we meet with our teams and our leaders, and we're going to make the best decision for our community. Again, we understand that this is a health crisis, and we are not going to put our students and families in jeopardy. And so, but we will make that decision, and that will be forthcoming later this week.
I think we all want to see extracurricular activities and sports. I mean, it is just something, especially in Ohio, football, right? But again, if you want students to get out on the field, if you want to go see your students play, then we have to come together as a community and really focus on what's important right now, and that's all of our health. Alyssa?
Hi, Alyssa Woodman-Neese with the Columbus Dispatch. I have two questions. The first was, what sort of supports will be in place for families who can't afford to have a parent stay at home with their young children and help them learn?
So I'll let Dr. Dixon jump in, but that is something I want you to know that these board members up here are very interested in and have been pushing and working with community partners to try to figure that. A lot of us are working parents, right? And so, again, there is no perfect solution. And so, unfortunately, what school has become, in this modern time is really the place where students get everything and has become the babysitter and has become the health clinic and has become all of that. And obviously, that doesn't work right now. So it really is critical that we continue to work with our partners, that we ask businesses to step up and help working parents. There are just some solutions that we as a district cannot do, but everything that we can do in our power to support our families, we want to do. And I don't know if the mayor wants to jump in here as well, but Dr. Dixon, did you want?
Thank you, Alyssa. I think, again, as it was stated earlier, those wraparound services, how can we make sure that the community wraps itself around the district? And we've seen so much of that during this time. We also have a Department of Engagement now. And we have someone who is dedicated on how do we engage our families and our partners and finding out exactly what they need and matching that need to a partner in the community. So we will continue to do that and advocate on behalf of our parents and our students and finding the best match to close those gaps that they have with whatever they need for their students. Yeah, it's a community effort, and that's what I love about the city has stated over and over and over, superintendent, whatever the community needs, we would join together in partnership in finding solutions so that our students can come back safely, but while they're learning at home and where our families need to go to work, that students have a safe adult or safe place to learn while their families are at work.
The only thing I would add is we have talked a lot this summer because we knew how great the need would be for young people who hadn't been in school since March to have meaningful, fun learning opportunities this summer. And so one of the partners, our key partners in that work with Recreation and Parks has been Columbus City Schools. As well as many other partners in the community, because the issue was we weren't going to be able to reach as many kids as we could normally because of social distancing, smaller groups, all the public health requirements and guidance to keep everybody safe while still offering those opportunities. We needed more space, so we're using a number of school buildings. We put $2 million worth of CARES funding out to Big Brothers Big Sisters, the Boys and Girls Clubs, the YM, to help expand those offerings to young people. One of the things that Dr. Dixon, President Adair, and I have been talking about is what does Recreation and Parks offerings look like into the fall, since at this point classes won't begin, albeit virtually, until September 8th. We've already added a couple of weeks to summer programming for August that weren't initially contemplated based on COVID. And so we're looking at what additional offerings we could provide to Columbus City School students and families later into the fall, obviously continuing to follow the guidance of Dr. Roberts and her team. But we believe this community, this entire community, has a role to play and make sure that kids are safe, healthy, that they're able to interact with other young people in a safe way, being physically active, so they can run off some of that energy, especially if they're like my 10-year-old who I dropped off at basketball camp this morning. But I think it's really important for me to reinforce, if children are our top priority as a community? What are each and every one of us willing to commit to do to get them back in the classroom sooner? To echo what President Adair has said, will we commit to wear this everywhere when we're out? Will we commit to stop those birthday parties and backyard barbecues, even if it's for a small group of people for the time being, to help us slow this spread? Will we encourage maybe our younger friends who continue to think that they are invincible, and because they may not present symptoms, continue to engage in behavior that we know puts them, their parents, and their grandparents at risk? What are we each personally willing to do if children are our top priority and their education is our top priority? What are each and every one of us willing to do to get these kiddos back in their classrooms as quickly as possible?
Thanks. And my second question may be best for the health commissioner, but we've had some folks ask us if places like restaurants and bars and gyms can remain open, why can't schools remain open at the same time? Some also cite the lower risk of complications for children who are infected with COVID-19 versus adults. So I was wondering how you can explain that to them.
Thank you for the question, and that's a question that keeps me up every night. As the mayor said, if kids are our priority, our number one priority should be getting these kids back into the classroom where we know they learn better than they do virtual. So I struggle with that, and I think that's part of the reason that City Council passed legislation that Mayor Ginther and I encouraged them to consider to reduce the hours of our bars. Dr. Burks was in town over the weekend, and her recommendation to us was to close the bars. And I know that's a hard pill for many people to swallow. And so the compromise was to allow them to stay open and to reduce their hours and to continue pressing the message forward of wearing your mask, avoiding those large gatherings, washing your hands, and staying home if you're sick. And I'm trying to be optimistic that if we as a community do those things together for the next few weeks and moving forward, we will be successful by bringing the numbers down, and we will be able to get our kids back into the classroom where they belong.
Thanks.
Other questions?
I have a question. I've been looking at our Facebook page since we're streaming this. Some parents are praising us for this, but a lot of people want to know what are we doing for our English language learner children and also our special needs children. That's been a lot of questions on our district website. So I figured since they're listening, if we could address that.
Thank you. So I'll have Dr. Dixon come up and address that more specifically, but I just want to remind everyone that we will maintain constant communication going forward. Not all questions can be answered today, but know that we are working diligently to get you the best information as fast as we can. Also, in terms of the students who are in these categories, as well as others like gifted, and we hear about these all the time. There will be more guidance, and Dr. Dixon can come talk about it, but check out our website. That's where everything will be most up to date.
Yes, thank you. It's a great question. And again, we have our special needs students, our EL students, and our gifted students, all of our students in mind to make sure that we have the right support and resources to support them in this learning environment. More information is going to come. We would continue to do our engagement sessions on Facebook Live. We've had several of those. We're going to continue with those and continue to give weekly updates to our families and our community stakeholders of what's happening in our schools. Great question. Stay tuned. That information will be provided to all of our families.
I just want to shout out to Vice President Reyes. This is one of the things that she is very passionate about. So she never lets us forget our English language learners, and so we appreciate her advocacy on that. Any other questions? Lisa?
I wanted to ask, I know right now, as of today, Columbus City Schools is not a one-to-one district when it comes to student and Chromebook. I know you lent out about 19,000 last semester. With the city's donation, it will be another 20. I know you've budgeted to purchase about 8,000 more, but still, will that complete the mission for the first day of school to be one-to-one, or will you still have children out there with no Chromebook, with no internet access at home?
So we will have Dr. Dixon come up, socially distant, of course. I'll put my mask on and move. Yes, so that is absolutely what we are working towards, and thank you to the city who really stepped up and made a large bit of that happen. I want to clarify, though, about the numbers and how the computers work, because I think there is a little misconception. So you hear the big number of computers, but the way that the computers were first purchased, buildings own the computers. So that's why we have to kind of do this shuffle in the funding because of regulation. So we're lending building computers out. But obviously in a virtual model or a blended model, we also need computers back in the building. So one-to-one, we would actually need more than 50,000 computers, right? So you might get to that number and be like, oh, they have all the computers they need. Not true. So this is still an ongoing process. So for right now, because we're still lending our building computers out, yes, but to get to full scale one-to-one, where every student can take what they need and then the buildings have what they need, we still have work to do. Dr. Dixon? No, yes? She said I answered it.
So there still might be cases when school starts that kids still do not have a Chromebook? No, okay, you're just doing the shuffle. Okay, okay. And then to, I think Dr. Roberts had left, but Mayor Ginther, if we can ask you, there has been a lawsuit filed now in Common Pleas Court in regards to the 10 p.m. mandate when it comes to restaurants, when it comes to bars. What will the city's move be now? And if they are successful in achieving an injunction, what is your fear here?
Obviously, we were anticipating this, and that's why from the very beginning, we worked very closely with City Attorney Klein, with City Council, as we drafted the legislation that they would consider. We feel very confident based on feedback and input, both from the City Attorney, from Dr. Roberts' engagement with Council, that we'll be successful.
Thank you, and we have now concluded this press conference. We appreciate all of you participating, and thank you, Mayor, thank you, President Hardin, and thank you, Dr. Roberts, thank you, board members. Thank you all.